welcome guys to another episode, the third episode of of delayed ejaculation. The first episode we talked about the causes. We talked about definition, what exactly it is. We talked about the classification, and we talked about when you need to see your doctor, right? So in this episode, we are going to talk about. The second episode we talked about the causes, exactly the causes, what causes delayed ejaculation, right? So in this episode, we are going to talk about the risk factors, right? The complications, and I'm going to mention something about treatment or management of delayed ejaculation, right? So what are the risk factors of delayed ejaculation? What increases your risk of having delayed ejaculation, right? So, one is old age. So, as you age, your risk of having delayed ejaculation increases, right? So, in older people, they have high risk of having delayed ejaculation. So, the first risk factor is old age, right? Yes. So the second risk factor is psychological condition. Are you stable psychologically, right? By saying psychological condition, what do I mean? The likes of you have depression, you have anxiety, maybe performance anxiety, you have low self-esteem, right? So psychological conditions like depression, low self-esteem, anxiety, particular performance anxiety, can increase your risk of having delayed ejaculation, right? Yes. So another risk factors, the third risk factor is prostate surgery, right? Right. While talking about the causes of delayed ejaculation, we talked about prostate surgery as one of the main causes of uh, one of the main biological causes of delayed ejaculation, right? So, having undergone prostate surgery, right, particularly the what we call transurethral resection of the prostate, this increases your risk of having delayed ejaculation, right? Yes. So, having undergone this can increase your risk of having delayed ejaculation, right? Yes. So the fourth risk factor is heavy or long-term alcohol drinking, right? Yes. So this increases your risk. It does not necessarily cause, but increases your risk of maybe in future having delayed ejaculation, right? Yes. When talking about the causes, we mentioned certain medication that can cause delayed ejaculation. We talked about antidepressants, we talked about antipsychotics, we talked about some anticonvulsants, right? So again, these are kind of medications increase your risk of having delayed ejaculation, right? Yes. So they increase your risk of having delayed ejaculation, right? Yes. The fourth or the fifth risk factor is certain medical problems, right? For example, if you have diabetes, if you have maybe diabetic neuropathy, if you have maybe what you call multiple sclerosis, these are kind of medical conditions that increases your risk of having delayed ejaculation, right? You need to know this, right? You are having diabetes, maybe you're having diabetic neuropathy, maybe you're having multiple sclerosis. They increase your risk of having uh, delayed ejaculation, maybe stroke, maybe uh, I mean stroke, multiple sclerosis, and the likes of diabetes. Your chances of suffering from delayed ejaculation are very very high. Again, if you're having unstable relationship, it can increase the risk of having delayed ejaculation, right? Yes. So I mentioned something about psychological condition. I've mentioned something about medical problems like diabetes. I've talked about old age. I've talked about prostate surgery. I've talked about certain medication like antidepressants, right? And I've talked about heavy alcohol drinking increases your risk of having delayed ejaculation, right? So again, drink responsibly, right? Yes. So what are the complications? What can delayed ejaculation lead in the long term, right? So one is infertility. Infertility. Delayed ejaculation can cause you infertility. How are you going to impregnate somebody if you cannot ejaculate, right? For example, our brothers who have lifelong, if you can remember the classification, we talked about lifelong delayed ejaculation, where from the onset of sexual maturity, you've never attained orgasm, right? So again, how are you going to conceive? How are you going to how are you going to make somebody pregnant if you don't ejaculate, right? So infertility is one of the main complications of delayed ejaculation. Somebody can only conceive, you can only make somebody pregnant if you ejaculate and ejaculate in the right place, right? Yes. So infertility is one of the main complications of delayed ejaculation. Another one is lack of sexual pleasure. Just imagine a situation where you, after maybe 45 minutes of continuous sexual stimulation, your partner reaches to a point of vaginal dryness. She's experiencing a lot of pain, right? Do you think she's enjoying the sex? No, absolutely not, right? So again, there may be lack of sexual pleasure. Your partner may be experiencing pain due to maybe the lubrication is over, maybe after 30 minutes or after 40 minutes, if you can reach that point, right? So you yourself have not attained orgasm, and your partner has already reached vaginal dryness. She's experiencing a lot of pain, right? And this may cause lack of sexual pleasure, right? So that is the second complication. The third complication, separation. Obvious. Delayed ejaculation can cost your relationship. It can cost your marriage, right? Just imagine a situation I've just mentioned some few seconds ago of after continued sexual stimulation, your partner reaches vaginal dryness. She's experiencing a lot of pain, right? She may decide to leave, or you may decide to separate if the problem continues to a certain extent, right? You, she may decide to leave and maybe join another club, maybe, right? So delayed ejaculation can cost your relationship. So it can one of the main complications is infertility. Another one is lack of sexual pleasure, sexual pain, right? And the last one, it can cost your relationship, right? Yes. How can you manage it? How can delayed ejaculation be treated? How can it be managed, right? So now in delayed ejaculation, the management depends on the cause. The management depends on the cause. There is no specific management of delayed ejaculation, right? Maybe your cause, you have delayed ejaculation. The cause may be either because you are taking some medication, maybe because of some medical problem like stroke, maybe because of psychological condition like maybe you are having depression, you are having anxiety, right? You are having no self-esteem. So the management will basically depend on the cause. There's no specific management. So you really need to see your doctor. You really need to consult with him or her so that she can investigate the cause. After that, she or he will lead you to the right path of treatment, right? Yes. So just to mention a few, there are medications. There are no currently there aren't specific treatment for medical treatment for delayed ejaculation. However, there are certain medications that are used to treat other conditions that can be used to treat delayed ejaculation, right? For example, we have something called amantadine. Amantadine is used to treat Parkinsonism, right? So it can help in treatment of delayed ejaculation. We have something called buspirone. Buspirone is used in treatment of anxiety, right? So it can help in the treatment of delayed ejaculation. But again, don't just go over the counter and try and buy this medication without any prescription, without any recommendation from your medical, maybe your healthcare provider, right? You need to consult with him or her, right? Yes. So there's this kind of medication, amantadine for Parkinsonism can help, or buspirone for anxiety. It can also help, but go to the medical, maybe doctor or the healthcare provider for further uh, assessment, and so that he or she can give the right treatment, right? So again, this I've talked about medication, and again, maybe you are using some kind of medication, the antidepressants or antipsychotics, and these are causing you to have delayed ejaculation. You need to see your doctor. Your doctor can recommend for you maybe a reduction in the dosage or change the whole medication, right? And this may solve your problem, right? That's why I'm saying there's no exact treatment, right? The treatment depends on the cause, right? Yes. Apart from medication, we have psychological counseling. Some may be just psychological, right? Maybe you're having depression, you cannot perform well. Maybe if you have depression, maybe you're having anxiety, performance anxiety, and this causes you to have delayed ejaculation, maybe having low self-esteem. What do you need? Do you need medical treatment? Absolutely no, right? You need maybe somebody to talk to you, need a counselor, you need a psychiatrist, right? So again, I insist, the treatment depends on the exact cause, right? Yes. So you really need to see your doctor. I've talked about psychological counseling. I've talked about medication, either reduction or new medication that can help you manage it, right? And again, you really need to sort your maybe your alcohol addict, right? You said among the one of the main risk factors of delayed ejaculation and one of the causes is long-term heavy alcohol drinking, right? So again, drink responsibly just by minimizing the amount of alcohol you take, maybe per day, maybe per week, can help you solve a lot as far as your sexual response cycle is concerned, right? So let's be better together, right? Let's be better together. So just see your doctor, explain to him or her, open up to him or her, so that maybe he or she can assess the situation and know exact cause, so that from there you can know the line of management, right? Yes. So don't just walk into a chemist, just walk into maybe a pharmacy and buy medication for the day injection. No, that's not the way to go about it, right? Yes. So I hope you learned. I talked about the definition. What is it exactly? I talked about the causes. I talked about the classification. I talked about when do you need to see your doctor. I've talked about the risk factor. I've talked about the complications of the ejaculation. And finally, I've mentioned something about the management and treatment. Yes, and that's marked the end of my video today. I hope you learned something very, very important. I hope maybe you are helped. Yes, yes. So if you are not subscribed to the channel, kindly subscribe, kindly like and share, right? And please let's interact in the comment section. Did you how did you solve your situation? Maybe you had delayed ejaculation some time back. Maybe how did you solve it? Has your life ever changed from there? Right? Yes. So let's just talk. Talking solves a lot of problems, right? Yes. So that's marked the end of my video today. The next episode I'm going to do something on maybe sexual dysfunction, erectile dysfunction. So I hope again you continue learning with us, right? Yes. So see you on to the next one.